All right, we are continuing our journey through chapter 14, our chapter that is not so much about adapting massage as it is adapting ourselves to be compassionate, nurturing, and understanding, and know our limits too. If it's not, if we just can't get over ourselves in a situation, um, if you just say you're working with somebody with a chronic condition related to HIV infection, and you just can't get over your hesitancy um, about you contracting the condition, then maybe you need to refer. If you find yourself judgmental, maybe somebody has a whole bunch of tattoos and you are disturbed by that and you can't get over it, then you probably need to refer. And we all have limits. We have limits that what the client is doing may not be illegal, and it is not even in violation of our professional ethics and standards of practice, but it does challenge and interfere our moral compass, our inside of us compass, our internal and personal values, and we are judgmental. And right now, at this particular time, we can't be different than that. And that requires that we put our clients first, and we realize that this is something we cannot adapt to, and that there's somebody else that can be a better massage therapist for them. Now, I'm not speaking of somebody being abusive or harassing or anything like that. I'm not talking about that. Um, I'm talking about how we respond to differences and how much we are able to do that. In this COVID crisis, this pandemic that we have had, there's a lot of fear in the massage community about uh, giving the virus to somebody and getting it. A lot of massage therapists left the profession because we are close contact, and they couldn't find a place of peace inside themselves about that, and that should not be judged. That's okay. They should be acknowledged as making a good decision. I don't want anybody to be making decisions on fear. But if that fear motivates us to take a logical look and do some critical thinking about something, because if we're a massage therapist, the career pathway has to satisfy us too. And if external situations have occurred, or our inability to adapt to a particular population or environment and be okay, then we need to acknowledge that and move on. Find something different, do something different. That's okay. Okay, it's okay. All right, here we go. This is a long chapter, isn't it? Lots of the chapter on complementary bodywork methods with stones and scraping stuff and suction cups and aromatherapy. That's kind of it's easier. This we have to really look inside ourselves when we think about working here. Okay. individuals with a psychological diagnosis. So we all have our limits. And there are some of us that have neurochemical conditions, situations where we can't adapt as well. And then on a behavioral and emotional coping process, we have limitations. And I say we because it is a we, even if it isn't diagnosed specifically. So I have dyslexia, but I've also been, so that would be a learning challenge. That would be more cognitive. But I also have anxiety with OCD. Now, who knows why? Obsessive compulsive disorder, and sometimes it's managed better and sometimes not so good. And it's perpetuated by that inner ear thingy I've got that makes me feel uncertain and unsteady and nauseous sometimes. It pushes some avoidance behavior because I don't want to be in environments that make me feel like that. And I didn't know what all this was when I was younger. And once I kind of could put some parameters and understanding, I could learn about it a little bit, then I could understand why I did some of the things I did. And I do take a medication to help with the OCD, and it helps a lot. And I've responded and adapted to it very well. Some people are not as fortunate. They have a hard time with these neurochemical imbalances. So this chapter is going to try to describe some of this. And with these psychological diagnoses, people can be judgmental. It's not observable. If you looked at me, you wouldn't know that I was anxious because something wasn't lined up in a pattern of 3. And even if you knew that, you wouldn't understand it because it's not the way your brain works. So let's delve through this. And we also need to, just like with physical impairments and the Americans with Disability Act, we also have to consider the Americans with Disabilities Act with these psychological issues that are not as observable. So here's the list, and we're going to do an overview on these. But if you wanted to work with somebody who deals with post-traumatic stress disorder, then you're going to need to know more about that. That's where your learning curve comes in. So chemical imbalance, I mean, we're such a chemical soup, and everything's got to kind of be seasoned right for that moment in order for us to be able to behave appropriately and think appropriately for the situation. And pain and mood, trying to find a way to be comfortable, calm, can be an underlying motivator for a chemical addiction. And what that means is that the chemical is used to make us feel better, even if it's just for a little while. A behavior can do it too. There are people that over-exercise, for example. Addiction just means that this is something that we do, probably exclusive to other options to make us feel better. And then whether it's resourceful or not depends on how well it is helping us feel okay and be able to function in relationship to how it's got detrimental effects and it's affecting others around us. So there are medications that can help with this, and they were still a little crude. Our own modulation of our chemical soup is really elegant. But if we're not able to do that as well within our circumstances, then the medication certainly can help. Along with, it's like managing diabetes. There's lifestyle. It's not just taking the medication. There's getting supportive help, and cognitive behavioral therapy can help. But medications have an important part to play. We also have intellectual issues, disabilities, where people are challenged with decision making and skills around that. So I think of the people I know with Down syndrome. They're lovely people. And just like everybody else, there are limitations that influence their daily life activities. But we should not discount what individuals that are slower or limited in processing and decision making and being able to maintain a linear thought process or hold on to a memory long enough to be able to do something like count money or whatever. We should not see that as making them less than anybody else. And just like with, I sometimes need help keeping track of things that I put down and then I can't find because I can't see them. We all need help. And so as people with intellectual issues, disabilities grow, people continue to treat them like children, and they're not, these individuals are not children. They just need a level of support. So there you go. And just like all of us, we need to understand where is each individual capable and where are they going to need some help. I remember having Luke doing some keyboarding for me, and he was taking something that I had handwritten or typed myself, and then he was putting it in a format. And he hollered out at me one time, "How many different ways, Mother, can you spell possibility wrong?" Well, a lot, apparently. And if I let that intellectual disability interfere and be too predominant in what I'm doing, then I would not be able to do the other stuff that I do really, really good. But I also know where I need help, and I'm okay to ask for it now. Didn't used to be. Used to feel silly or stupid or that people were going to look down on me or something. And I don't anymore. I've matured, and it's taken me a long time to get there. I would hope that people are more supported today with our understanding of diversity. So this goes into the whole cognitive differences too. Is something like what we label attention hyperactivity disorder. Is that a disease? Is it a malfunction, or is it a difference? this is where the dyslexia comes in too. And if we put a bunch of people on an island that had similar manifestation of dyslexia as I do, we'd be fine. It's only when there is a demand for those of us that function in a little bit different way, are trying to fit in and function with the majority. And how much is it okay for a small segment of people to be expected to adapt and respond and be inclusive with an individual that may feel challenging to you? And of course, my opinion on that is that we need to get over ourselves and realize that if somebody's behavior is bothering you, you need to talk to them about it. And most people, if they can alter that behavior, they'll do something about it. And if they can't, then you also need to do something about it. I remember in the classroom having people that are cold. They're cold and they want the heat up. Well, I'm usually hot, so I want fresh air. And so they'll complain, but they sit next to the door or the window instead of bringing a sweater and sitting on the other side of the room. So, all right. So I personally have the idea of neurodiversity, and I am intrigued by the way that various brains, nervous system, neurochemicals, all of it together work. I like it. And so I'm personally tolerant, very, in fact, I often don't even notice how somebody's way of functioning in their world is different or even annoying to somebody else. I know I can be annoying. I don't annoy myself. Sometimes I annoy myself, but usually not. But I do know that lots of times I am more relaxed and more comfortable when I'm alone, where I don't have to be constantly trying to alter my behavior so that it doesn't annoy somebody else. So we have these attentional issues, and we have the autism spectrum disorder, these labels. We have learning disabilities, and we need to figure out how to help individuals function the very best they can in the general world that they want to function in. And we also need to adapt the world some, so individuals with neurodiversity respond or aren't under so much stress all the time to adapt to everybody else. So in this regard, our response as a massage therapist is to understand some things. Like maybe somebody needs a little help reading the paperwork, or their handwriting is bad, or maybe you have a whole disclosure statement on your website and you expect everybody to read that and get it. And they don't, they can't. It's, you know, that's why I appreciate my publisher, Elsevier. They are attentive to this, and I really like the read to feature for the electronic textbook. It's good for everybody, but for some people, it might be really helpful. A lot of the way the chapters are outlined and the way they're presented is to support people with challenges in this area. I am understanding of people with attentional issues. A lot of people with this diagnosis, which I'm not so sure I like, but they're drawn to massage. Massage is something where they can narrow their focus in. But they might have some trouble with time management. With clients that I know have these tendencies, I'll remind them. I'll call and remind them. Well, they should know. Well, maybe. With clients and or students that I have had on the autism spectrum disorder, I understand that there's a different way that they might need the classroom organized. I help them. I'm very open and help them understand how potentially eye contact or voice modulation or whatever might be confusing to a client if they don't explain this. I do the same thing with people with some post-traumatic or some head trauma where it's interfered with maybe their speech or something. So I try, and I want all of us to be part of allowing people to be okay, knowing that we also, I speak of the we, have to adapt to a world that's different from what we would prefer. And I would like understanding, and I'd like to give understanding for people that find that ongoing adaptation challenging. And I also know that there may be some things that I'm not, I speak of the we again, I can't do. Can't do it. And then I need to admit that and ask for help. So I have had quite a few clients, various stages on the autism spectrum disorder. It used to be called Asperger's syndrome, but high functioning. Very fascinating to me with the focused attentional abilities sometimes here. And the spontaneity and the creativity that can come out of attentional issues. And I like the way my brain works. Sometimes it's difficult and it's time consuming, but there's also things that are really cool about it. I got really cool pattern recognition, even though my spelling is horrendous. Okay. Psychiatric disorders. So this has a lot to do with mood. And this is where, in our ability to process our environment. So we've got anxiety, panic, depression, eating disorders, etc. A lot of wrapping around on this. There are some very successful medication treatments. Cognitive behavioral therapy can be very helpful, as support groups can be very helpful. Counseling can be very helpful, and it's usually a multi-pronged approach, and massage can be very helpful. Panic disorder is rough. I've had some panic attacks. I know people that have panic attacks. I have had clients that have had panic attacks. And you can think you're dying. And it can often feel like a heart attack or something serious is wrong. And if somebody comes in and there's a lot of breathing disruption, here's where the breathing really comes in and helping people mechanically breathe better, which is going to shift the oxygen, carbon dioxide, and the rest of that whole internal control mechanism so a person can come more into a parasympathetic balance where things are not so frightening. But this physiology takes on a life of its own. And if we just understand, sometimes it'll take 15, 20 minutes for those neurochemicals to shift. But you know, when you've got panic going, you're convinced something terrible is going to happen right now. Living with anxiety and panic and pain and swings to depression and that whole thing makes you tired. It's hard work to live in a brain like that. And so we get these other manifestations that come along with it. We should know, clients should feel confident enough with us to disclose that this is part of their experience, but there's a lot of prejudice and judgment around this, so it's very likely that people won't disclose, and that's unfortunate. So I will tell you that as far as massage is concerned in this arena, if we can help people breathe a little better, they're going to sleep a little better and they'll do a little better. In chapter 15, the next one up, there's some self-regulating activities and understanding about breathing. And then with massage, it's usually a very good focus on the torso, back, sides, and anterior torso, and to allow for the pliability for the mechanical aspect of the breathing to work, as well as regulation of the autonomic nervous system, with massage being anti-arousal. I mentioned eating disorders before. These are difficult because they can be hid until there is the bulimia, the purging can be hid. The anorexia, it can be so persistent that it's life-threatening. These are difficult. When you work with somebody with an eating disorder, your job is to work with them as a massage client, aware of the physiological shifts and changes that can occur with irregular eating and nutrition. But it is not your job to deal with the eating disorder. So this talks about that. You know, how are we going to serve our clients that may be manifesting or living with some of these differences? There's a big topic here called post-traumatic stress disorder, and this is pervasive, and it comes from a variety of situations where the series of events, regardless of what they were too big for us to process. And we cope the very best we can. And sometimes the stress response, the sympathetic stress response, or the dissociative response that comes with that coping can be persistent. So this does not always require exposure to a physical trauma. This also can be a psychological trauma, emotional, And so this is something where, again, if we are working with somebody with post-traumatic stress disorder and all of its manifestations, we can be very helpful as part of a comprehensive care program. And we may not know with clients that they have some trauma that has influenced their life or their body or their function in such a way that they have not been able to resolve it. And this is hard because we get caught up in the stories and the nature of the stories. And we really have to be careful not to do that. Because the tendency would be is the more horrible the story, the more we would give credence to something. And then we are internalizing it. We're making a judgment about whether or not this deserves to rise to the level of trauma based on what would be traumatic for us. And we really can't do that. If we're working in this realm, then we're back with our first two outcomes primarily. Palliative, or our categories of care, palliative and condition management. And the outcomes would be relaxation and well-being, stress management, and oftentimes there's a pain issue too, somatic pain issue. And so, you know, if you can hold on to this, the more complex the history and the condition, the more basic and foundational the massage, then you'll be okay. So you're not going to fix this stuff, but you can be part of how a person copes and becomes resilient. So do be careful of getting caught up in the story and in some of the behaviors that might rise out of that. You know, there's been a time when this was really considered, well, if I work with this and this dissociative behavior comes forth, then the person's going to be able to deal with it, and that's just not true. If we have such a dissociative behavior is described here, I have this. If I'm getting a massage and somebody is pressing down on my thorax, regardless of the position I'm in, it gets very weird for me. And so it doesn't limit my life, except that I can't stand anything tight, a tight band around my thorax. And so it's sort of a societal expectation that women wear a bra. But I am miserable, way more above and beyond just the discomfort from some past trauma to my thorax. And that will limit me. If there is a situation where I know that I'm going to have to dress up, to be dressed in a way that's going to be socially acceptable, I am very anxious. Now, that might make you chuckle, but it is a really good example of how people will respond and behave and ignore and avoid in these kinds of situations. So dissociative behavior in its purest form is a coping mechanism. We all have coping mechanisms. Where it becomes problematic is when it's not working as a solution anymore. When we developed the coping mechanism and we experienced it as successful, then it worked. It works. That also happens with chemical type of addictions, including food and exercise, where we're stimulating our own chemicals. But if it doesn't work anymore and we don't know how to find another way to have a solution, then it can be really problematic. And massage therapists are not trained to deal with this. What we can do is help the person be more settled and sleep a little better and be able to take a full breath. And when those things are in place, maybe they can find a way to cope in a more productive way. We can't fix this. Intrusive experiences are part of this. That is a memory that explodes into our head that we can't get out of. And a lot of people have those. And there will be ways of coping. So an example of that, of a coping thing, and I can talk about myself, is that I usually go to sleep to an audiobook that will keep my brain engaged enough. Now, I can't get too into the book, but enough so that I don't have intrusive memories. And like most people, if not all, I have had trauma, loss, sadness that can haunt me. And so I have found ways to cope with that so it doesn't consume me. Now, somebody might say, oh no, you have to go to sleep in a very quiet environment, and that is distracting from your ability to sleep, and it's going to interfere with the restorative nature of the sleep. But you know what? It works for me right now. And it's not hurting anybody else. And it is not significantly interfering with my life. So again, it's not our job to try to fix an intrusive experience, but it is our obligation as a professional to understand this. So we've got a couple of proficiency exercises here that are going to challenge you about these types of issues, because we've all had something along these lines. We've all had it, and so it's important for us to find compassion and empathy. Compassion and empathy are not about us. They're about the other, whereas sympathy and that sort of thing, that's about us. So we want to develop compassion and empathy. And to do that, sometimes we have to take a really good look at us so that we know when we're going to have our own challenges around this and find some of our own coping mechanisms that will work better now. But remember, they worked as a solution once. So, okay. This chapter gets a little intense, doesn't it? What? Odd. Maybe this is telling me that this is a little intense. So let's stop. If I can get to it, let's stop the share and then go back to that and see if we can find our share screen, see what happened with that. So something happened with my page burst that's telling me that that's enough for right now. So I'm going to end this video and be gentle with yourself and others. Not an excuse. These things are not an excuse, but they can be reasons for why we need to seek help and understanding, know our limitations, we all have them. Not an excuse, but it can be a reason that can help you cope better once you look for solutions.